Now I'm going to shift, I'm going to sort of make you shift your mind to something quite different, and it might take you a minute to realize what the significance is. I'm going to switch over to some other data I found on cancer progression survival rates, okay, between 1971 and 2007, okay? And here, the simple point I want to make is, this is what can happen if you create the ecosystem, as it were, of practice building on knowledge and research and theory and evidence that's published, and then people with entrepreneurs picking that up, taking it the next step forward, etc., and building and building and building upon that. This is the sort of thing you can get, okay? Which is actually, in some of those cases, you probably can't see it at the back, but some of the progression survival rates. Now, you remember, so cancer incidence generally is rising through all of this. So this is not about the incidence of cancer. This is about how long people survive once they've been diagnosed with cancer. I mean, not all of these have been very successful. At the very bottom, you know, lung and pancreas and brain tumours, actually, the progressive survival rates actually have not really improved a great deal, to be honest, since 1970-71. But some of them actually quite dramatically. Now, if I mean, I would have thought anybody who is a researcher, a funder, an oncologist, a nurse, or whatever, who is involved in treating cancer would probably, I mean, I imagine, would probably feel pretty pleased with this sort of chart, because actually this clearly represents the progress of knowledge and building on evidence and improving people's lives. Because once again, behind this, there are real people and real lives and families and all that sort of stuff, okay? So all I want to do with this is just to give you a sort of a vision of why people like us, Project Oracle, sort of kind of obsess about research and evidence and data and building knowledge and things like that, because we want to try to get to this sort of point, yeah, away from, and as I said, it's not quite clear where those targets, where those curves were going, from those other graphs that I showed earlier. Now, some of you are probably thinking, and rightly so, look, you can't quite compare the criminal justice, you know, youth crime, youth violence in London to the sort of pharmaceutical sphere. And that's fair points, because there are some significant differences. But let's take that further. Let's think, okay, well, what are those differences? Okay, some are obvious around funding and things like that, but and that make it very difficult to compare. But there is one which, the one that we're most interested in, is about what is the difference between how the medical pharmaceutical sector generates and creates knowledge and then uses it and builds it onto practice and entrepreneurship, right? So let's take a look at that. Now, this is a simplified version of how that happens, and anybody who knows anything about medical research can tell me where the arrows are in the wrong place and doesn't have this order and that sort of stuff, and of course that is all true. But there's some kind of mainstream treatment, oops. Sorry. There we go, sorry. Mainstream treatment that, you know, leads to some kind of research on the back end. You've got academics and labs and that sort of thing going on, leading to publishing results. And what's interesting, if you go into PubMed, which is the sort of massive database of all medical research that is publicly available, 22 million citations in PubMed, and you can go and Google all sorts of stuff, and you will find articles written by doctors about, we gave this combination of drugs to 5 people in this hospital, and 3 of them, this what happened, 2 of them, this what happened. You know, some of those articles down to that kind of level of detail. Yeah? All available online. You know, positive results, negative results, indifferent, ambiguous results. With a bunch of entrepreneurs, so you know, whether it be big pharma, whether it be small companies or individual doctors, picking up some of that and saying, well, actually, we've got something here, let's run with it. Coming up, developing some program, testing things, trials, which may lead to one of 3 ways. You know, they'll publish that. Here's what the results are. Some of it may end up in mainstream treatment, and that's where the building blocks come, and some of it just fades away because actually it didn't really have the process, it didn't really have the impact. So it's that sort of process, that sort of ecosystem where you've got researchers, you've got practitioners, and you've got funders all engaged in this way with a set of incentives and culture and practices that we now, in Project Oracle, are seeing how can we try to replicate in a sort of small scale in London. Okay? So we can move to that point where we actually see progress upon progress upon progress. Okay? So that is really a sense of the vision of Project Oracle. If we, I'm not going to go into this, but if we looked at actually how does that process work right now, okay, what happens to these links? Probably every one of these links you can say, well, there are weaknesses for sure. So what gets researched? How much research is there? Not enough. Not very much, really, to be quite honest. Our own synthesis review has some, and thank you to everybody who sort of has forwarded stuff there, but not a great deal. We're going outside as well, outside London to bring in some of the evidence from outside. What gets published? So there's probably a whole lot of reports and things like that that actually are sitting, or certainly data that's sitting in your organisation, doesn't get published. It doesn't get published actually because there's probably not much incentive to publish it. Certainly if it doesn't look great, you know. That's a big challenge that doesn't actually quite exist in the same way in the sort of pharmaceutical medical world. Entrepreneurs, are they building off published knowledge, public data, evidence, that sort of thing, or are they responding to needs? You know, I mean, and you know, entrepreneurs are critical to this system because they're the people who bring about change. But actually, they need to bring about change on the basis of evidence and what's already known, rather than reinventing the wheel. Okay. What gets tested? Do things get trusted, trialed? Does it become part of mainstream? And does anything fade away? Does enough fade away? Should we be expecting more fade away? So there are all sorts of weaknesses in how that sort of idealised system in some way it sort of works in London. And let me, one point, I mean, and let me be clear, I'm not holding up that sort of pharmaceutical medical model as actually a fantastic example, because actually it's flawed in many ways. It's flawed in many ways because of incentives, because of bias, because of prejudice, all sorts of things. And if you want a taste of that, I do recommend Ben Goldacre's book, Big Pharma, which will make you think about the medicines in your cabinet in a different light. But even a flawed system actually creates a lot of progress through, as shown in that slide above. So what we're trying to do through Project Oracle is try to create an ecosystem that builds knowledge and builds evidence, and that the incentives and the practices work towards that. So I can't remember if I actually... I mean, just going back to sort of what is different about the medical sector, obviously there's a stronger regulatory system, there are incentives, which I talked about, standard practice to publish results. Practitioners are trained in use of evidence, understanding of evidence, nurses, doctors, researchers, everyone has some minimum level. And there are resources available to test and publish. You know. Some of these things are completely missing, but that has created an evidence-based culture and practice. So what are we trying to do? So when Georgie talks about all the different activities that we're doing through the standards of evidence, through the training, through the reverse placements, trying to build up some knowledge, trying to build up capabilities, with the evidence competition, trying to provide the incentives and the motivation. We're all trying to sort of use slightly different levers to bring about that kind of change.